Hello, and welcome to Module 5, Infection Prevention and Control.
So let's begin with our objectives. By the end of this module, you should be able to discuss the importance of infection control measures, recognize how germs spread, learn what staff can do to help stop the spread of infection, learn approved infection control practices in home care, and develop a better understanding of some illnesses and viruses. So let's begin. I always like to start with some interesting facts. Did you know that more than 2 million infections occur in healthcare settings every year? The leading cause of death in nursing homes is infection. And infection is also the most frequent reason why a person is moved from a nursing home to a hospital for care. So let's take a few minutes to look at some definitions. You should have some handouts that give you some definitions that you will hear me speak of throughout this presentation, and it also gives you a basis of some terminology when you hear people talk about infections and infection prevention. So take a few minutes, hit the pause button, look through those definitions, and use this time to ask your preceptor, your mentor, or educator if you have any questions before we begin. Please come back after you've had an opportunity to do that. So let's talk about some personal hygiene habits. It begins with you. So I have a few do's and do nots listed. So I'd like to talk through those, and I'm going to be adding some additional ones as we go along. So do practice good personal grooming. That means taking a bath every day after you see your patient. It's a good practice when you get home to change your clothes, take a shower, get any types of germs off of your body, brush your teeth, practice good hand hygiene, wear clean, unwrinkled clothing, cover your mouth and nose when you're coughing or sneezing, and washing your hands frequently. If you're sick, don't provide care for your patient. This is a good time for you to talk with your supervisor about what is the policy and how do you call out if you are sick. Please note that your agency may have a point system or some system to keep up with absences. However, your fear of getting points should never override your making a good decision so that you're not coming to work sick. Oftentimes, people will come to work because they're afraid of disciplinary actions or they're going to get in trouble, and then they come to work sick and they make the other staff sick, they make the patient sick, etc. So if you are sick, please do not come to work. We've talked about good grooming. The other thing I'd like to add is it's important to keep your hair up because and your agency may have a policy about your hair and how it has to be maintained. If you have long hair, it just really is unsanitary to have it down without putting it up. So talk with your supervisor about that as well. It's important to hold equipment and linens away from your body or uniform. If you're changing linens on the bed, they are going to be dirty. They may be soiled with urine or feces. So hold those away from you whenever you're changing the linens on the bed. Do not get home and wear your uniform around the home that you've worked in. It's unfortunate, but we all like really try to multitask, and so we get home and we're busy and people don't always stop and take off their uniform. Please get into a habit of doing that. It helps to stop the spread of infection into your home as well. And so we're going to talk about some of the do nots. I'm going to make sure that we've that you're not taking your own personal belongings into a patient's home. We've talked about not wearing your uniform in your own home. It's important not to eat or drink after other people, and that's just a really good habit to get into. So the things that you can think about are what are good basic hygiene principles? Hand washing, hand sanitizer, covering your mouth, limiting exposure to lots of people in big crowds, especially during cold and flu season. Um, what are good ways that you can stop the spread of infection? And we're going to talk more about that, but really practicing your own personal hygiene. And that's really important. So let's talk a little bit more about infection control. It all begins with understanding how germs spread. So how do germs spread so quickly and easily? Let's use colds and flu as an example. Colds and the flu are caused by viruses, and these viruses can be all around us. We don't see them. They may be in the air that we breathe, on the objects that we touch, etc. These viruses can be easily transmitted as we share the air and touch many of the same objects, doorknobs, pencils, light switches, faucets, etc. In fact, germs can be even transferred by people who do not seem to be sick themselves. So this is that period of time where people are contagious and they don't mean to spread the viruses. So if we knew that we were sick, people would stay home. But unfortunately, people are contagious before they are ever sick or feel sick. So they are shedding those viruses, and that's how people end up being sick. Germs can be expelled into the air by sneezing and coughing. Covering one's nose and mouth when sneezing or coughing can prevent germs from being expelled into the air. So here you have what's listed is called the chain of infection. How does infection spread? The chain of infection is the foundation for spreading and preventing an infection. For an infection to occur and spread, each of the 6 links of the chain must be present. By breaking any link in the chain, a new infection can be prevented. Infection control practices such as hand washing, cleaning of equipment, using masks, um, and when used properly, these things will break the link of the chain of infection. Let's take a look at each of the link and its actions that can be used to break it. This is the one time when breaking something is actually a good thing. To have an infection, there must be a germ that causes the infection. This germ is called the infectious agent. The chain of infection starts with a reservoir, which is an infection agent or a germ, bacteria, etc., virus, must have a place to live or hide out. This place is called the reservoir. Reservoirs are animals, insects, humans, objects, surfaces, equipment, or almost anything from the environment, including food, water, and even the air that we breathe. So the portal of exit. The germ needs a way to leave its home or hideout. This is called the portal of exit or the way to escape from the reservoir. Examples of how germs exit the human body are through blood from a wound, semen, vaginal secretions from the reproductive tract and genitalia, tears from the tear ducts, urine from the urinary tract, feces from the gastrointestinal tract, mucus discharge from the respiratory tract, drainage from open wounds and across the mother's placenta to the fetus. So the mode of transmission, once the germ exits its hideout or the reservoir, it must find a way to move to its next victim. This is called the mode of transmission. There are many routes for germs to be transmitted to another. The most common and frequent modes of transmission are direct contact, indirect contact, and droplet contact. Direct or physical contact occurs when the infected person transfers the germ causing the infection to another. Indirect contact includes the spread of infection through eating or drinking contaminated foods, waters, or beverages, touching contaminated products and personal equipment, utensils, pets, equipment or feces, or any other non-animal object. Droplet contact can happen when an infectious person coughs, sneezes, or talks within 3 feet of another. Germs can also be spread through contaminated blood as well as through the air. Infections can be spread through the air by a person breathing air where germs have been suspended. Insects such as ticks, fleas, or mosquitoes can carry germs and pass them on whenever they bite someone. I think we're all pretty familiar with some of the infections that mosquitoes may carry, for instance. And then what is the portal of entry? The portal of entry is once a germ leaves its hideout, finds the way to travel, the portal of entry is necessary. Germs can enter the body through breaks in the skin, through eyes, nose, or mouth, through the digestive tract, through the urinary and reproductive tracts, the respiratory system, and the circulatory system, and points of exit and entry are the same. So the susceptible host, that's me, you, any of us. If the host's defense are strong, it may stop the germ's invasion. If not, the host becomes a susceptible host, unable to fight off the germs, and the germs can enter the body. The chain of infection now has the potential to continue to spread since the germ has found a new reservoir. So let's think about the times whenever you get sick, right? People get sick not only when they have an altered immune system, such as cancer, etc., but just when they're stressed, when they're tired. Um, Anything can cause us to become a susceptible host. So infection control practices such as hand washing, cleaning of equipment, using masks can stop the spread of infection. It is going to be your job to be able to practice good hand hygiene and wear your personal protective equipment in order to stop the chain of infection. Below are listed as some examples of how to break the chain of infection. Using alcohol-based hand rubs. However, the norovirus, or what some people refer to as the GI bug, does not respond to alcohol-based hand rubs. So if you're only using hand-based alcohol rubs, gels, etc., then you still have the potential of getting the norovirus that is only protected through good hand washing. Wearing a mask and eyewear with patient contact. Now, depending on your agency's policy, during the time of heightened flu or COVID season, your agency may have a policy on what's required. That may be a mask and protective eyewear. It may be a mask only, so you need to have conversations with your supervisor about that. Wear appropriate transmission-based PPE. Follow the CDC guidelines for hand hygiene. Cover your mouth when sneezing or coughing. Staying at home when sick. Not wearing acrylic nails. Your nails, if you have acrylic nails, they harvest a ton of bacteria. In fact, most hospital-based systems and home care agencies have prohibited the use of any acrylic nails because they do harvest so much bacteria. And an example of how harm could occur would be if you have acrylic nails and you're helping a patient to dress and your nail accidentally cuts the leg of a diabetic patient and bacteria enters into their leg and causes a wound, an infection, etc. Using only agency-approved hand sanitizer and soap. Not all hand sanitizer is the same. It has to have a certain percentage of alcohol in it to become effective. Using clean gloves. Don't gel your gloves. There was a time during many years ago when we first started with COVID that people thought that it was a good idea to gel their gloves. Please do not do that. I left that on here because I think it's important that some of these old practices am finding still are occurring in some agencies. Making sure that you have immunizations that are up to date, you have a proper diet, and proper biohazard waste and trash disposal. Please make sure that you're emptying your trash as you leave your patients every day. So let's talk about hand washing. When hands are visibly dirty or soiled, they should be washed. Wash with soap and water. Wash hands after using the restroom. Hand sanitizer doesn't kill C. diff or the norovirus. Wash hands with soap and water. If hands are not visibly dirty or soiled, it is okay to use an alcohol-based hand rub for routinely cleaning hands in other situations. Now, it's important that while you use a good technique to wash your hands, that you are also drying your hands on paper towels and not the terry cloth towels that are found in patient homes. So when should hands be cleaned? Immediately before touching a patient, before moving from work on a soiled body site to a clean body site on the same patient. So let's stop. What does that mean? So from moving from work on a soiled body site to a clean body site. So that means if you are helping with a bath and a patient has soiled themselves during the middle of the bath, you are going to clean that patient up. You are going to take off those gloves. You are going to wash your hands and you are going to reapply clean gloves. So making sure that you are washing your hands in between. After touching a patient or the patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, before putting on gloves and immediately after glove removal, before and after touching your eyes, nose, or mouth, before and after touching your mask, before and after leaving a public place, before and after touching a surface that may be frequently touched by other people. So, hand hygiene. Here's a tip. Bring agency-approved hand soap, paper towels, and hand sanitizers with you to every patient's home. Many homes will not be able to supply these items. Never wash your hands with a patient's bar soap, or again, dry your hands on patient's towels that are hanging in the kitchen or the bathroom. You may do that in your own home, but please do not do that in a patient's home. These may be dirty or possibly could have been hanging for several days. Check with your agency about approved lotions. Many lotions have a strong petroleum base or an oil base, and those will actually break down your gloves. So be prepared, bring your own supplies, and your agency is required to provide you with the necessary protective equipment needed to provide safe patient care.
Now let's talk about the proper technique for hand washing. First, wet your hands with clean running water, warm or cold, and apply soap. Rub your hands together to make a lather and scrub them well. Be sure to scrub the backs of your hands, between your fingers, and under your nails. Continue rubbing your hands for at least 20 seconds. Rinse your hands well under running water. Dry your hands using a clean towel or air dry. Washing hands with soap and water is the best way to reduce the number of germs on them. If soap and water are not available, use an alcohol-based hand sanitizer containing at least 60% alcohol. Alcohol-based hand sanitizers can quickly reduce the number of germs on hands in some situations, but sanitizers do not eliminate all types of germs. It is really important to note that there are certain types of disease processes, such as the norovirus, where just hand sanitizer alone will not clean your hands thoroughly.
Now you have another handout. This is a hand washing handout, which is the proper technique. This is where an instructor demonstration on proper technique and the student critique on each other is going to be required. So hit the pause button, take a look at that handout. Please practice and talk through hand washing. This is one of the most important things that you can do with patient care is wash your hands. It really sounds quite simplistic, but the outcome can be tremendous. So please make sure you do that, and this should be filed in the employee record. So once you're done, come back and take me off pause and we'll continue. Welcome back. Let's talk now about proper technique with hand sanitizer. How should you use hand sanitizer? That seems like a silly question, doesn't it? Apply a dime-sized amount of the product to the palm of the hand. Rub your hands together. Rub the product all over surfaces of your hands and fingers until your hands are dry. Do not wave your wet hands in the air trying to get the hand sanitizer to dry faster. Rub them until they are dry. So that is the key to hand sanitizers, is once you put it on, you will rub it on your hands until they are dry. I would suppose that would be a test question at some point through this training, so you will see that again. So breaking the chain of infection, what is your role? As healthcare workers, you have always had a huge responsibility to protect yourself, your family, and your residents from danger because you work in an environment that encourages infection. The people that you care for are generally elderly, sickly, frail, and are susceptible to diseases. What is just a cold to most people can be deadly to an older adult. If you can break any link of the chain of infection, you can prevent the occurrence of a new infection. Aides have many chances in their work to break the chain of infection. Keeping your patient's home neat and clean helps to reduce the risk of infection. It is the role of the aide to care for the person and their environment. These tasks are essential to good health. The best way to break the chain of infection is hand washing and wearing appropriate PPE, personal protective equipment. So when infection occurs, if an infection does occur, the body takes steps to fight it off. When the body fights off an infection, certain signs and symptoms will occur. Signs and symptoms of infection could include a fever, nausea, vomiting, diarrhea, rash, loss of appetite, local redness, swelling, foul-smelling drainage or urine, urinary frequency, pain or tenderness at the site of a wound or a pimple-like area, fatigue, weakness, tiredness, flu-like symptoms. And individuals have different responses to different types of infections. Not all symptoms will be experienced by all people. Learn the usual health status of each person that you are caring for, so you will know that when there is a change in their typical health status. Report any signs or symptoms immediately to the nurse. The earlier an infection is found, the easier it may be to treat. There are also certain factors which contribute to increased illness, including susceptibility in patients, um, poor nutrition, advanced age, mental status, inactivity, and other factors such as catheters and feeding tubes. I'd also like to mention that sometimes with our elderly patients, they can have something very subtle, such as a change in their mental status, and it doesn't always necessarily mean confusion. I had an aunt that when she had a urinary tract infection would cry. She would become really sad and very emotional and she would cry. And so every time she became emotional, I knew she had a urinary tract infection. Sometimes with older people, they actually become confused. Becoming confused is not an a sign of a normal aging process. So don't think, well, they're just getting older and they're becoming more confused. They really could have a sign of infection. I'd also like to point out that COVID has been so elusive and people have so many different signs and symptoms of COVID that somebody could have a rash and have COVID, but maybe not have other symptoms. Um, so just know that there is not a textbook. These are textbook um, types of infections or signs of infections that we have certainly known through the years, but there are so many other signs that are not textbook. The bottom line is that if a patient has a change out of their normal state, call the office and report it to your supervisor. That's really the most helpful hint. Some agencies may provide you with a bag in order to carry your supplies into a patient's home. If they do that, here are some helpful tips for you. The outside of the bag is considered dirty and the inside of the bag is considered clean. Always go into your bag with clean hands. Never store the bag on a dirty surface or on the floor. Clean equipment after use before placing it in the bag according to your agency policy. COVID-19 or home infestations. Do not take your cloth bag into a patient's home. Only take a Ziploc bag or a bag that you can clean into a patient's home so that it can be discarded. That's going to be really important. Now, some agencies have vinyl bags that are easily cleaned. Some agencies have larger bags. Some have fanny packs that they're able to clean. It's going to be important to find out from your supervisor, do you have a bag? What is your agency's bag technique? And what is supplied to you to be able to actually clean the bag? Now, many years ago, before COVID, most agencies had cloth bags. Some still do. But after COVID, we found that it was just easier to go with something that is easy to be wiped off after a home visit. So take this time to talk to your supervisor about if the agency provides you with a bag. If so, could you see a bag? Could you also see a copy of the bag technique policy? And can your supervisor or your preceptor, whoever is with you, can they demonstrate appropriate bag technique for you? I'd like to spend a little bit of time talking about bloodborne pathogens. This is probably not a new term for you. Bloodborne pathogens such as HIV, hepatitis B, C, and D are classifications of microorganisms that cause disease. They can be found in blood, sebum, cerebral spinal fluid, which is the fluid in the spine, synovial fluid, which is fluid in the joints, pericardial fluid, which is fluid around the heart, amniotic fluid, which is the fluid around the baby during pregnancy, and in vaginal discharge. Bloodborne pathogens can be found in other fluids if contaminated by infected blood. These pathogens may be transmitted by contact with blood, sexual contact, sharing of needles or needle sticks, mother to fetus during pregnancy or delivery. Employers should have an occupational exposure plan in place for all employees. An occupational exposure plan includes needle sticks, skin exposure, mucous membrane exposure. The occupational exposure plan may consist of a hepatitis B vaccine program, policies for reporting, evaluating, and handling exposures, and documentation procedures, including employee review of the plan. It is essential that you report any occupational exposure. What is an occupational exposure? If you get stuck by a needle, that is an occupational exposure. If a patient has COVID and you are unmasked and that patient is unmasked, you need to report that to your employer. Why is that important? They need to monitor you for symptoms, right? So ask to speak with your supervisor. Ask to see if there is an occupational exposure plan and can you review it. Let's move on. So what about Hep C? What is Hep C? Hepatitis C affects the liver and can be considered an acute or chronic medical condition, needing monitoring and lab work on a regular basis. The CDC reports that 75 to 85% of acute infections develop into a chronic infection. There is no vaccine for hepatitis C. However, your doctor can test for Hep C with a blood sample, and it's important to note that it can live outside of the body for up to 6 weeks. Influenza. What is the flu? There are several different types of influenza or the flu. There's seasonal, avian, swine, variant, pandemic, and a smaller amount of others. The highest number of flu cases are reported from October to March of every year. It's labeled flu season. However, a person can contact the flu at any time of the year. I am filming this recording in February. Right now, we are seeing lots and lots of flu cases. The CDC tracks everything related to the flu. the types of cases, predictions, etc., and publishes weekly surveillance reports. For information about current statistics, I have listed the CDC website for you for your review. The influenza, the flu. Symptoms of the flu include fever, cough, sore throat, body aches, headache, chills, and weakness. The severity varies depending on the age and the health status. Flu is spread through respiratory droplets from coughs and sneezes, or if one touches the droplets of someone infected and then touches their own nose or mouth. So how can you stop the spread? Wear your mask and eyewear when providing care for someone with the flu and practice good hand washing. Also use alcohol-based rubs often. The person with the flu should be encouraged to stay home and talk with their supervisor about the agency policy when they return to work. Encourage the person with the flu to get plenty of rest and drink plenty of fluids. Bacterial infections may follow, such as pneumonia, ear infections, or sinus infections. The patient should get medical care immediately if they have any of the following symptoms: difficulty breathing or chest pain, purple or blue discoloration of the lips, vomiting and unable to keep down liquids, signs of dehydration such as dizziness when standing, absence of urination, or if infants lack tears when they're crying, seizures, and if they're less responsive than normal or they become confused. So let's talk about COVID-19, the coronavirus. In 2021, COVID-19 was responsible for 8.8 million deaths worldwide. That is an astonishing number. So think about that. 8.8 million people. It is spread person to person through respiratory droplets. Coughing and sneezing spreads the virus, which is then inhaled into the lungs. Contact with infected surfaces or objects is also a potential risk. Symptoms include a dry cough, shortness of breath, and not always a dry cough. Sometimes people have more of a wet cough depending on if they've had a lot of nasal drainage. Extreme tiredness, which is called fatigue, digestive symptoms such as an upset stomach, vomiting, loose stools, or otherwise called diarrhea, pain such as severe headaches, body aches, muscle aches, fever or chills, cold-like symptoms such as congestion, runny nose, or a sore throat. There are preventative measures you can take to reduce your risk. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you're sick. Get the vaccines, the boosters. Clean and disinfect frequently touched objects and surfaces. Clean your hands often. Ask your supervisor about your agency's policies regarding appropriate PPE with COVID. You may also have screening questions that are required by your agency every time that you see a patient. Some organizations still have that implemented years later, where whenever you arrive to a patient's home, that you ask a series of questions such as, do you have a fever, cough, have you been around someone who's got COVID, been sick, etc. And you are expected to ask those questions before you are providing care. So I have listed for you the appropriate PPE at the current time for caring for someone with COVID. So I'd like for you to hit your pause button, spend some time with your supervisor, go through the process of donning and doffing, putting on and taking off appropriate PPE, and also spend some time with your supervisor or your educator and talking about how will you be given those supplies. Now, in order to provide care to a patient with COVID, you may be given a special mask called an N95, and you may be specially fitted for that type of mask. So it's important to have a conversation with your supervisor about what is the policy that regarding staff providing care to a patient who has COVID, or they may be labeled as a PUI. It's a person under investigation. That is a person that we suspect of having COVID. Um, so that could be whether they're sick and we're waiting on some tests to come back. Maybe they don't have a COVID test in the home today and we're having to get a COVID test so that they can get tested. But your supervisor saying, hey, we think they are a PUI. We are not able to get them tested. The family can't get a test there until tonight. So where you're what we refer to often as a COVID PUI kit. So please hit your pause button, take a look at the slide, um, think through the donning and the doffing and what is required for PPE during COVID care. And then come back after you've had that discussion. All right, welcome back. Let's talk about MRSA. MRSA stands for methicillin-resistant Staphylococcus aureus. It is a bacteria that has changed or evolved to the point where it is today, where there is no medication that will kill it. That's the tricky thing about some of these things, like HIV, for instance, COVID. They change, right? And so now MRSA has gotten to the point where there is no medication to actually kill MRSA. It can be caused by the overuse of antibiotics in humans, the antibiotics in food and water, or germ mutation. It is spread by direct skin-to-skin contact. It can become a problem when it enters the body through a cut or a wound. So in the community, risk factors for MRSA are contact sports, sharing athletic equipment, young children, the elderly, having a compromised immune system, crowded or unsanitary conditions, close contact with healthcare workers. MRSA is often carried by well-meaning healthcare workers who don't take the time to wash their hands or put on gloves. Long fingernails and acrylic nails can also be blamed for helping with the spread of MRSA. So you may hear that someone enters the hospital without an infection. Perhaps they've had surgery. When they get home, now they have a wound infection. So the wound infection could come from people not properly washing their hands. MRSA is most often spread in healthcare settings, especially with those with weakened immune systems. Look for red bumps that look like boils or pimples, which may turn into abscesses. The infection can also spread to the bone, the blood, the joints, the urinary tract, the heart, valves, and the lungs. Good hand washing can stop the spread of MRSA. Bed bugs, absolutely the worst thing that any supervisor has to deal with in home care are bed bugs. Bed bugs are very small, flat, parasitic bugs that feed on the blood of humans and animals, typically where they sleep. They are expert hiders and can live for several months without a blood meal. The presence of bed bugs does not indicate a dirty environment. They can hide and travel with people in luggage and from place to place. It's absolutely why I hate to stay in a hotel is I'm always fearful of bed bugs. Bed bugs do not transmit diseases. They are not directly a health risk. However, their bites can cause a range of reactions in people. Often their bites will itch and you'll see that someone's scratching their skin, and where someone has been scratching, that itself can lead to an infection. So why do I say that it's absolutely one of the worst things ever? It's because these bed bugs can run and hide in the walls, so someone can treat for them. And if, like, you have a patient in a multi-housing unit complex, like a senior apartment, and one apartment is treated, these little bed bugs will go into the walls and go right onto the next apartment. So they are very elusive. Um, so many times home care agencies will put on pause the care for a patient that has bed bugs until they receive something back from an exterminator saying that the house is cleared of bed bugs. If your patient has red raised bites on his or her body or complains of itching or sleep issues, it would be smart to examine the mattress and sleeping area very well. Sometimes the bites will be in a straight line, other times they'll be random. Since bed bugs are small, they hide in the crevices of the mattress, box springs, sheets, and near furniture or bedding. Their droppings are a dark reddish color, and they will also be on the mattress or under sheets. Infestations need to be treated with insecticides, which you should not use yourself. There's also heat treatments, which is really probably the most effective way to treat bed bugs, but it's also very expensive. Reach out for resources to help your patient. If you suspect that a patient has bed bugs, report it immediately. There may be a way that your supervisor can reach out for some resources to try to help with extermination if that's necessary. Talk about C. diff. C. diff causes severe diarrhea and other intestinal disease when competing bacteria in the gut have been wiped out by antibiotics. Traditionally seen as a hospital-acquired disease, now seen more in the community-acquired space. Spreads from hand to mouth through indirect contact. Hand washing with soap and water is very important. Symptoms include frequent watery diarrhea, abdominal pain, nausea, and/or fever. And hand sanitizers are not effective against C. diff. Community-acquired infections. They're generally categorized differently than hospital-acquired. As the name suggests, they are infections acquired in community-based settings. Some examples are listed for you. Lyme disease and other tick-borne illnesses, Legionella, antimicrobial resistant infections, influenza, bacterial pneumonia, botulism, norovirus infection, and HIV and Hep C. The employer's role in infection control. It is the role of the employer to inform the staff of the precautions needed in order to provide safe care and to provide appropriate education for you. The employer has the following responsibility for PPE or personal protective equipment at the employer's expense. They must provide it, maintain it, and replace it. They must ensure accessibility in appropriate sizes, provide hypoallergenic gloves or alternatives if an allergy exists, and ensure that you have the appropriate use. So today you've learned a lot about infection prevention and control. Um, we're still learning, right, in the space of ever-changing cold, flu, COVID, um, and always thinking about, is there a new infection that's out there lurking that we haven't learned of yet? So stay abreast. Your supervisors, your educators will provide you with education on an ongoing basis as things change. There may be certain times that your PPE requirements change. You may be mandated to wear a mask during cold and flu season in times where there are COVID peaks. So just stay in contact, ask how the information is disseminated. I hope you've learned something today, and so we're going to conclude today's session, and we'll talk with you at the next module. Thank you.